Hello and welcome to Autistic Changeling. Today I'm going to talk about top surgery because I had top surgery about 2.5 weeks ago. That's why I didn't do a video 2 weeks ago, because I was recovering from top surgery, and I did think about doing a video, but I decided I was just going to focus on recovery. And also, I wasn't here at my apartment. I was at the Airbnb in California because I had surgery with Dr. Mosser in California, and I do not live in California. So I flew in and stayed at an Airbnb with my parents, who also do not live in California, and who also flew in and stayed at the Airbnb with me. My parents were there to support me and to help me with all the things I needed help with, which was great and wonderful, and I really appreciate it. Yeah, we stayed in San Francisco, which is where Dr. Mosser's office is. We were actually within walking distance of the office, which was great and not actually intentional. We just found that out by accident. So that was good. Obviously, we didn't walk back after surgery because that would have been a bad idea, but we did walk there for my pre-op appointment and stuff, so that was good. The pre-op appointment was pretty basic. I already had my official pre-op appointment 2 weeks before, like they usually do, but because I don't live near enough to his office to go in person, I also had an in-person pre-op the day before surgery. Basically, they repeated a lot of stuff we'd already talked about. My mom was there so she could take notes because she was the main person who was going to be helping me. And they took some pictures, presumably for Dr. Mosser to reference to make sure nothing had changed between the original pictures I took for the consultation and now. My mom asked some questions. They gave us prescriptions to fill. They prescribed me a pain medication, an anti-nauseant, and something to help with constipation because that's a pretty common side effect from the anesthesia and also from the pain medications. So we got those filled, which was a bit of an ordeal actually, but that's not relevant. So we got those filled, and then we had some time to just do your general touristy stuff because my surgery wasn't until the next day. They apparently thought they might have to move my surgery earlier in the day, but they didn't. It was already pretty early in the day. It was scheduled for 9 o'clock, so I arrived at 7. They said to not eat anything after midnight, which I did not do. I didn't eat anything. I followed the instructions. So I didn't do anything from that. They didn't make me go off any of the medications I'm on, which was good. Some surgeons do require patients to go off of birth control because of the very slight risk of blood clots, but because top surgery isn't a kind of like you're allowed to walk around after surgery, it doesn't immobilize you for that long of a period of time that the risk is really significant. So Dr. Mosser decided I could stay on my birth control, which is good because I take it because my period cramps are really, really painful, and I didn't want to have to worry about excruciating period cramps on top of everything else. Because that's like the reason I was prescribed it, so, you know. That was good. I didn't have to worry about going off of that, and I didn't have to go off of my anti-anxiety medication either. When we got in, they had some forms for us to sign, well, for me to sign. My mom went with me. I signed the forms they wanted me to sign, then they made me change into one of those hospital gowns. I was allowed to keep my pants on. Apparently some people are told that they have to completely strip for it because some surgeons use a catheter and some don't. Dr. Mosser doesn't. It's only a short surgery. So I didn't have to do anything like that. I just had to strip from waist up and put on the hospital gown. I was allowed to keep my pants on, which was great. And I had to wear one of those really awkward hospital hat things. And they gave me socks, which I didn't like. I didn't like the socks. They also gave me a Vicodin because apparently that's their standard procedure to calm people down. And I'd never taken Vicodin before. My mom took video. I was giggling a lot and talking really quietly. It was really weird. It was really weird. It did calm me down though, enough for them to put the IV in. I'm really glad they waited until I'd taken the Vicodin before putting the IV in because I'm not a fan of that. I was really worried about the IV. It wasn't actually a problem. It didn't hurt very much. I was just a little squeamish about it. So they put an IV in. They just put a salt. It was just a saline solution, but they were gonna put the anesthesia in through there, I think, when they actually had me in surgery. So there was that, and then the anesthesiologist came in. I don't remember what he said. And then Dr. Mosser came in. He drew on me on my chest as guidelines for where he was gonna cut, I guess. But I was pretty high at that point on the Vicodin. I don't remember much of it. So I do remember him coming in though. And then They took me to the actual operating room and they laid me down on the table or something, and then I have no memory beyond them asking me to put my arm out, because that's presumably when they put the anesthesia in the thing, and I knew I wasn't going to remember anything because I had my wisdom teeth out, and I don't remember anything from that either, and that wasn't supposed to knock me out, and I still don't remember anything. So that was fine. That's how I like it. I like not being aware of anything like that. I'm a little squeamish. So that was good. Don't remember anything until I woke up in the recovery room, which is just a different room. My incisions hurt at that point. They weren't really very painful. I didn't have very much pain most of the time. They did hurt just after waking up though. And I was like really groggy and a little confused, like when you wake up out of really deep sleep. It was sort of like that. And then there was a nurse there, and she gave me some crackers and a little bit of water and some pain medication. It wasn't the same as the pain medication they prescribed me, but it was pretty similar, I think. And that helped with the incisions hurting. And then she let me lay there for a little bit, and she'd called my parents, and then my dad came as well, and they helped me into the lift and back to the Airbnb. I woke up and they'd already put the post-op binder on me. I guess some people are told to use like ace bandages or to buy a compression vest or something. Dr. Mosser already had the binder, and he put it on me with safety pins for the drains and bandages and all that. I didn't have to do anything with that when I woke up. I did have drains. Dr. Mosser gives patients the opportunity to choose whether or not they want drains, but he recommends them. So I got drains. I didn't want to worry about having any issues with swelling or hematomas or anything like that, so I decided I would suck it up for the week. Drains, if you're not familiar, are basically what they sound like. They're to drain fluid, to prevent any fluid buildup in the incision area. So where they put drains in is along the very edge of the incision towards like under your armpit, because the incisions for double incision are two incisions like there and there. Oh, I don't know if my camera is actually situated so you can see what I'm pointing at, but basically, yeah, I was gesturing on my chest just then, but I'll show you that later. Basically, the drains go where the incision is under your armpit, and they come out from there, and it's just plastic tubing where like the blood and other fluid can flow through that and into some bulbs at the end, and the bulbs are compressed to provide some suction, and then once they fill up to a certain amount, you can empty them. So I had those. The areas where they were inserted into the incisions hurt a little bit, but other than that, it wasn't so bad. And they were safety pinned to the front of the post-op binder to allow me to like keep track of them and not have them all over the place, which was good. I actually packed safety pins, but it turned out I didn't need them. They had some bandages and stuff between my skin and the binder, and there were also the nipple bolsters, because for double incision with free nipple grafts, which is what I got, they sort of cut off your nipple, resize it, and then like graft it back onto your skin. And they have like bolsters in place for the first week to make sure that the graft takes. So I didn't have to worry about any of that, although the bandages kept falling out from the binder because they were just kind of like stuck in there, which I guess is fine for most people, but something about the way I move and the way I move my chest just seems to make the binder like, I don't know. I had issues with the post-op binder. Stuff kept falling out. I had to put it back, and that made me anxious, but it was all fine. It was fine. It was just annoying. So the first couple of days I was really tired. We'd set up an area on the couch with some pillows to sort of like allow me to lay back a little. I didn't want to lay on my back completely because I am not a back sleeper, and I knew I was going to struggle a bit with the fact that you're not supposed to sleep on your side for the first while. But it was okay with the sort of an incline thing. My mom was good at arranging the pillows to make it comfortable. So I just sort of slept and watched TV a lot for the first couple of days. Day 3 was more of a problem. For the first couple of days it was fine. Between the anesthesia and the pain medication I was taking, I was okay. As a side note, the pain medication did not make me high at all. I'm pretty sure it was like an opiate type of medication, and I was kind of worried about like any potential addictive properties, but all it did was make me feel tired and slightly nauseous. So that's probably good. Although day 3, I was having a hard time keeping food down. I wasn't eating enough for it to not make me nauseous, because apparently it makes you more nauseous if you don't have anything in your stomach. But I was tired and not feeling great because I just had surgery and I didn't keep enough food down, so then I started vomiting. And then the anti-nausea they gave me was actually worse. I don't know. The anti-nausea they gave me had a very strong flavor, and it was taken sublingually, so you have to put it under your tongue and let it dissolve. And something about it was either the sensory issues from the taste or the actual medication just not reacting well with my system, and it made me vomit every time I tried to take it, so I gave up on that pretty quickly. Eventually I just stopped taking the pain medication, switched to acetaminophen, and once it left my system I was okay. I didn't have any other issues with vomiting or nausea, and was finally able to keep food down, which was great. So yeah, overall experience with the pain medication is that it sucked. Same experience my mom had with it after a knee surgery she had a while back. So yeah, that was unpleasant. So fortunately for me, my pain levels were such that the acetaminophen was sufficient to keep everything in check. I actually expected top surgery to be a lot more painful than it was, but the incisions didn't really hurt that much. You know, if you put pressure on them or something, then they hurt more, but for the most part it wasn't so bad. The worst was around the sides where the drains were inserted, but even that wasn't too bad really, it was just annoying. So the acetaminophen was enough to keep that in track. Acetaminophen is the generic name for Tylenol, in case anyone didn't know that. So that wasn't so bad, and I didn't have too much swelling, so the drains were okay. There was some fluid, and my mom had to empty them a couple of times, but it wasn't really that big of a deal. Once we got past the vomiting on day 3, it was a lot better. That was like the worst of it, I think. I actually had a lot more mobility from the get-go than I expected, and I think this is unusual because everything I've heard from other people's experiences is that they had a very hard time using their arms for anything, but I really didn't. I don't know why. It's probably just some weird fluke. It was good. I was able to, like, you know, get myself up into a sitting position and off the couch and all that with no problems. And I don't really have any tightness or anything. You know, if I reach too far, then it starts to hurt because, you know, it's probably supposed to be a warning to not do that. But for the most part, I've been fine on that count, which is great. So that was okay. And, you know, got through until the post-op appointment a week after, well, 6 days after surgery, because my surgery was on Tuesday and the post-op appointment was the following Monday. So I got to the post-op appointment and they took off the post-op binder, which was such a relief. I hate that thing. I still had to wear it for another week afterwards. We'll get to that. So they took off the post-op binder and the bandages. They took the drains out, which was not pleasant. They said it wasn't going to hurt. It did hurt a little bit, not gonna lie. It did not hurt around the incisions where they actually hurt when they were in. It hurt like somewhere else, like inside my chest. I don't know. It was a weird feeling. Was not a fan, but it wasn't that bad. I mean, it was unpleasant, but it was only unpleasant for a couple of seconds. So, you know, it's not the end of the world. And it was really good to have the drains out because they were annoying. And they restricted my mobility more than like the actual incisions. So I didn't like the drains, but I'm glad I had them because I didn't have any issues with swelling or with like seromas or anything like that. So I think it was a good choice to have them. They were just unpleasant. So they took out the drains. They took off all the bandages, which was great, and took off the nipple bolsters. I'd spent the first week terrified that they were going to take off the nipple bolsters and then the nipple grafts would just fall off, which I knew logically was not going to happen. That does not happen. I don't think that's a thing that has ever actually happened. But in my head, that's what I was anxious about. And from what I've seen from other people's experiences, that's a pretty common anxiety. I think most people are convinced at some point that the nipple grafts are not going to take and they're just going to fall off. I've never heard of that actually happening. I've heard of people losing parts of the nipple graft. I don't think I've ever heard of someone losing an entire nipple graft, let alone both of them. But a lot of people end up anxious about it anyway. I'm still sort of anxious about that, but logically I know it's fine. So that was good. They didn't fall off. Taking off the nipple bolsters and the stitches around them did not hurt at all, I think, because I was still pretty numb in that area. And I was numb a lot more at the beginning than I am now. I do still have some areas of numbness around the incisions, but I think they're going away slowly, and that's fine. So yeah, that didn't hurt at all. So then they put a different type of bandaging around the nipple graft. It's sort of, it was like a mesh with oil on it, like an oil emulsion mesh, and that just sort of like is supposed to just stick to the skin around the nipple graft and keep it moist. And then there is a bigger bandage they put over the whole thing, and they showed my mom and I how to do that so that we could keep doing that for a week, and then we could stop with the oil emulsion bandage and just wear the bigger bandage, which I'm still doing now for a couple more days. And I cannot wait until that's done. We'll get into that later. And then I just had to wear that with the post-op binder for a little while longer. I had to wear the binder for another week. Theoretically, it wasn't for compression, just to keep everything like around the nipple graft safe. Because again, I didn't have really very much swelling, so that wasn't as much of a problem for me, which is good because I ended up taking off the post-op binder a day early because I just could not put up with it anymore. The post-op binder was a really big problem for me for some reason. It kept moving around. I could not keep it in place. But I also couldn't put it too tight because it just isn't designed that way, and it was starting to get loose and fraying, and I don't know. It kept irritating the skin where, like on the top of the binder, and then the area where you're supposed to, because this was like a stretch of fabric that you sort of wrap around yourself, and then it like has Velcro, and the Velcro area here didn't like line up properly, and it kept irritating my skin. I don't know. That was very unpleasant, and I gave up on it eventually. So I did take that off a little early. It was only a day. It was fine. I mentioned it in my follow-up appointment, and Dr. Mosser said it was fine. So it was okay. Not that I'm recommending it, like follow your surgeon's instructions, but I couldn't do it. So I also had issues with the bandages. For some reason, the oil emulsion kept just drying up and falling off after a while before the day was up, because it's supposed to last a day, and then you switch it out for a new one after you shower. But it kept falling off before then, no matter what I did to try to keep it in place. And the tape that I was using for the bandages, like the bigger one that goes on top, either did not stick to my skin very much, or was very painful and like causes irritation and swelling localized to the area where it was. So I'm still trying to figure that out. They gave me some tape to begin with, and that was okay for the most part. It kept falling off, but it didn't cause as much pain and irritation. But then we ran out of that, so then we had to get new tape, and that was painful. That's what I was using that for the first bit, but it causes a lot of irritation and redness around the area where I take it off. So I gave up on that. Switched to trying to use Band-Aids as tape. Which is what I'm still currently doing. It's not a great solution. They still kind of fall off, but so did the first tape they gave me, so I don't know. I think maybe I'm just sort of twitchy and move my chest too much, and it's just, I don't know. I don't know. I think just the way I move makes this whole bandage situation more precarious. I'm not sure. But yeah, for the most part, I'm feeling really good. I mean, a little worn out, but that's normal, and that's fine. I have pretty decent mobility, which is a good thing in that, you know, more mobility is good, right? On the other hand, I'm still technically not supposed to lift my arms above my shoulder level, so like not above like here. The thing is, I am perfectly capable at the moment of lifting them much higher than that without any physical repercussions to let me know I shouldn't do that. So, I feel like I'm going to end up having to be very careful to not accidentally do that, because I feel fine. But you're not supposed to lift your arms too high because it can interfere with the healing of the incisions. So I'm going to try to be careful about that. But yeah, other than that, everything's fine. Still anxious about the nipple grafts, but like I said, that's something everyone ends up being anxious about, and most people I've heard of are fine. So, but yeah. The first week was very confusing, I guess, because you have all the bandages and the binder on, and you're still kind of like, because it's a post-op binder, it feels sort of like I'm just binding. So then I was like half convinced they didn't really do anything, which is again something I've heard a lot of people say, because it's a post-op binder and it still sort of feels like you're wearing a binder. And then even after they like did the reveal and they take off all the bandages and stuff, because I still have to wear the post-op binder, I would still sometimes be like, oh no, when do I have to take my binder off? And then I realized that that's not the same binder. So, but again, that's something I've heard other people experience as well. And once I stopped wearing the post-op binder, that was a lot better, and it felt a lot more like, oh yeah, I have actually had top surgery, and I'm not just wearing a binder for a lot longer than I'm recommended to wear a binder for. So that was good. And I know how these types of videos go, and I know that everyone's going to be like, oh no, where's your reveal video? I did not take video of the actual reveal. I did take a video this morning after showering to show you all my results and also to complain about the irritation from those bandages. So here you go. Alright, so I just got out of the shower, and before I put the bandages on, I'm going to show you my results. You can see my skin is really irritated around here. This is entirely from the bandages because this is where the tape goes. I actually used Band-Aids instead of the tape yesterday because I just could not put up with it anymore, but it's still really irritated and the Band-Aids keep falling off, which is probably also not great. Sorry about the traffic noises in the background. Can't do anything about that. Okay, they're done. So, nope, they're not done. What are they doing out there? This is a quiet area. Anyway, it's usually a quiet area, but you can see my scars connect. This is to reduce like any kind of puckering, like where the scars would meet, because usually, if anyone here isn't familiar with top surgery results, usually like the most common scar pattern for double incision is for scars to usually only like go to about here. But in some cases, like mine, it's more likely that there'll be puckering or some other kind of undesirable visual effect if you don't connect the scars. Although some surgeons will curve them upwards instead, which I did not want. And Dr. Mosser tends to have the incisions meet in the middle if that is something that may happen. My incisions also go pretty far over onto my side here, just to reduce the likelihood of dog earing. Dog earing is basically where instead of it being like flat on the side like my results are, if there was like a pinch of skin here, that would be a dog ear. I was told that it wasn't really very likely that I would get dog ears, but I really didn't want them, so I'm glad I don't have them. The nipples look pretty bad right now, but they're supposed to. I'm only like almost 3 weeks post-op, and they're supposed to look kind of bad for the first couple of weeks. My understanding is that this is like a scab that's going to flake off eventually, and then the actual nipple will be underneath. But of course I'm still anxious about the nipple grafts, because everybody's always anxious about the nipple grafts, but it's fine. Other than that, I mean, there's really not much else to say, I guess. I'm really happy with my results. We'll be happier once I don't have to apply the bandages from hell. But, yep, here you go. And yeah, as you can see, I have good mobility, which is good. I mean, there's no real, like, tightness or anything, which makes me suspect my scars are going to thicken, but I'll live with it. Alright, thank you everyone, and I hope you enjoyed this video. Don't forget to like and subscribe, hit the little bell for notifications, comment if you've got anything to say about this video, or if you want me to do any particular topic in an upcoming video, and I hope you have a great day.